Hey people, it's your boy Knowledge, Universally Alkaline. Um, Today I want to touch on mental health. I, I got friends who, deal with it. I deal with depression from time to time, hence why I smoke so much. But as I've set out to do, I'm here to give you a breakdown and a natural way of treating it versus taking uh, prescription medication. So, bipolar mood disorder, or what is known as manic depressive disorder, or is so many names. So, but bipolar mood disorder is is a variant of classic depression. Typically, it begins as depression and develops into alternating periods of depression or moments of mania, or the way we describe it. Some days we have highs, some days we have lows, and just trying to find a balance. Uh, People with bipolar disorder may go from feeling unrisk, they may feel like they're invincible, and then sometimes it can be suicidal. I'm not gonna bullshit you. I'm gonna keep it real. That's what I'm here for. I understand my purpose, so I'm giving y'all this knowledge. Hence the name. Um, some of the symptoms of bipolar disorder are changes in sleep pattern, a withdrawal from society, or what we tend to call seclusion, or solstice. You know what I'm saying? Uh, just trying to find peace. You know what I'm saying? Like just having something, a way to get away. You know what I'm saying, from everything, because a lot of things can be intense. Um, Sudden loss of interest in and failure to finish products that were started with enthusiasm. Uh, Irritability. Sudden attacks of rage when crossed. Changes in sexual behavior that may range from a complete loss of sex drive to sexual access. Yeah. Um, it's about 2 million. It's about 2% of the population in the states that deal with uh, this disorder, or we're gonna just label it all as some kind of mental illness. Um, you got the mania side, you got the depression side. They both can vary in their severity. Uh, the length of the cycles from depression to mania and back again can occur over the course of a few days, or months, or sometimes shit years, man. Like, you know, sometimes we can get stuck in a rut, and it's hard to shift the energy. It's hard to shake that low, that negative energy at times. Um, Low self-esteem, feelings of hopelessness. Those are characteristics of the depressive phase. Some people don't even know how to identify it. You know what I'm saying? They just know that they had their days. That's how it's labeled. Like me myself, I had to learn it and find out and realize I like I say I deal with depression from time to time, because I'm an empath, so I soak up so much to where it get intense, to where I have to back away from everything and everyone to realign myself and find that inner peace again and bring myself back up. Some don't have that ability. That's why I'm doing what I'm doing, to at least give you somewhere to start at. Some when we experience, we had them moments of depression. We lack the motivation to want to do anything, even get out of bed. You know, sleep. Just all we want to do is just sleep. We don't want to do no social activities. We avoid relationships, friendships. Sometimes we don't even want to get up and go to work, and that ain't cause like the job is shit. It's just that we just don't want to do shit. Like it's one thing for me to explain, but those who deal with what I deal with, you know where I'm coming from. The mania side of it is just like that. You know what I'm saying? Like sometimes you can't. It ain't no warning. Like no lie. I'm not shit. I had one last night. Yeah. Got pissed off because I understood that. And give me. I know I'm stepping away from this for a minute, but I got pissed off last night because like I say, I'm an empath. I feel a lot of shit. I experience a lot of shit, and I know a lot of people's energies was off because of, you know what I'm saying, leading up to this full moon that happened yesterday on the 3rd. I know a lot of cosmic energy, chaotic energy, and karmic energy was being thrown around, or if you notice people in their emotions, or you could tell people, I don't want to say a tantrum, but like in a sense I felt like certain people who were expressing themselves because they're not getting their way, or they're not getting something that is supposed to be fulfillment, or you know what I'm saying, part of your life purpose or whatever. Um but the periods of some what some of us experience is what's called hypomania, excitement that does not necessarily appear to be a sign of mental illness. You know, people just think we just oh, they having a moment, they in their feelings. Nah, like we going through some shit. Um, you know what I'm saying? Like just, you know, great enthusiasm and energy. Others experience full blown manic psychosis, in which they seemingly have boundless energy and are ceaselessly, my bad, active and easily distracted. I have those moments too. Like I could be focused and razor sharp, and then I fall off. Go take a detour. Get off the road and be going through the woods just for the fuck of it. And sometimes I have to reel myself back in. You know, we don't want to rest. Sleep. You know, it's hard. You know, we don't want to rest or sleep for 24 hours or more. And I know a lot of y'all don't believe in zodiac, but I'm gonna tell you something. My Aries, my fellow Aries, I know we can relate. We had those moments where like the body be tired, but this keep going. You know what I'm saying? And it's just like sometimes they don't know how to shut down. We could be dead fucking tired, laying in the bed and shit, and just hard to go to sleep, or like I call it, I can't find that comfortable spot. And it's not the comfortable spot in a bed or anything like that. It's that comfortable spot up here to where the activity is not as much going on, to where I can, you know, ease myself into it. Um, Mental activity is sharply accelerated. That's pretty much what I just explained. And delusions of grandeur, persecution, or the invincibility are not uncommon. Most of us with this condition seem to be utterly elated for no apparent reason, but some unreasonably irritable are irritable and hostile. I have those moments as well. Like I could be cool, and then the next second I go off on your ass. I don't try to. It happens. So I'm a work in progress. A lot of us are fucking work in progress. Some may even have hallucinations, but you know, despite all this, a person experiencing full-blown mania generally believes that he or she is functioning at peak efficiency. Only to a certain degree. It may not be peak efficiency for like a positive outcome, or something that is conducive to you. The cause of this order is not really understood, but it's several theories to the origin. That it may be triggered by extreme stress. Hereditary may be a factor in causes. Some researchers believe that Early experiences such as the loss of a parent or early childhood trauma play an important role. Um, Others believe that the manic phase is used unconsciously as a kind of a physical compensation for the depression side that otherwise engulfs the individual. Biological factors can also be possible. Um, Evidence of intracellular, in, I'm sorry, tongue ring make it hard to sometimes pronounce things. There is evidence that intracellular sodium increases the mood swings of bipolar disorder. Uh, then returns to normal after recovery. Also known that in depressed individuals, brain chemicals called mona, monoamines are depleted. Um, the symptoms of some childhood physiological disorders, such as attention deficit disorder, other known as ADD, or attention deficit hyperactivity disorder, ADHD, uh, conduct disorder, and schizophrenia, can be similar to those of mania. Uh, so through examination is needed to avoid misdiagnosis, because a lot of people really do get misdiagnosed. Um, it's not uncommon for children who are diagnosed with psychotic depression to be diagnosed with bipolar depression as adults. Like, if you take the time to go back into yourself and rewind the tape to your childhood, and certain events have a play in how this develops or how it processes that event. Because sometimes the mind has fail safes that keeps the mind, protects itself from itself, is what I'm saying. Like, you can go through some shit and you may not talk about it, you may not process it, your brain might take it and be like, I'm a compartmentalize this shit back here. And then sometimes it comes to rear its head at times. You know what I'm saying? If it goes undealt with, or if you don't, you know what I'm saying, seek some type of professional help, you know what I'm saying, or have a psychologist or a therapist. I'm going to personally start looking into one, because I have a hard time opening up talking about shit. But I'm also using this as a tool, not only to give y'all knowledge, wisdom, and information, but like, I'm opening myself up to. We all got to go to another level. Um, but unless otherwise specified, the doses recommended for adults, for children between the age of 12 and 17, reduce those doses to 3/4 of the recommended dose. For children 6 to 12, use 1/2 of the recommended dose. And for children under the age of 6, use 1/4 of the recommended amount. Now, a list of recommendations before I get into the nutrient side of it, you know what I'm saying, to keep from being on things like lithium and Leviathan and Prozac and those things. Which, that sodium depletion I was talking about, that's one of the ingredients in those prescriptions. But it's other things to where, like, I don't take any. I'm not a fan of synthetics. But I know people who take them, and it's like, either it fucks with your sex drive, or you feel like a fucking zombie, or you're oversleeping, or you end up not sleeping enough. Like, with the medications and shit, it's hard to dial that shit in to find out what's going to balance you. You know what I'm saying? So it takes a while, and while it takes a while, you go through some shit. But learning is something we have to live with, so we got to deal with. But recommendations, as far as from what you can do about it from a natural standpoint, A diet consisting of vegetables, fruits, nuts, seeds, beans, and legumes. Whole grains and whole grain products are recommended, except those that contain gluten. So yeah, it just ain't people who got a gluten allergy. Like a lot of us who deal with depression or some form of mental illness, it like gluten-free diet, please. Um, which could which should be consumed in moderation. Because yeah, eat white fish and turkey once a week. I don't do the white fish. I don't really do meat. I do salmon, which gives you your omega 3s and your omega 6s, which also helps with this function and stuff. Oh yeah, like I say, eat fish that are high in omega 3 fatty acids. Tuna, salmon, mackerel, and herring are good choices. Like I say, I don't eat meat like that. Salmon is the meat that I'm saying like that because I have an understanding of me, my condition. I got knowledge of self, and I'm trying to give y'all knowledge for y'all selves. So like that's why I just said, you know, like I fucks with the salmon because of the omega 3s and omega 6s and the fatty acids, which are good for brain function. Yeah, like I said, fish high in omega 3 fatty acids, tuna, salmon, mackerel, and herring. Those four. And also you can eat turkey, not sliced turkey, because you got to understand, lunch meat ain't real fucking meat. That's some shit that's gelled together. You ain't never called no turkey and the fucking slice fell over like that. So that's why I'm saying that shit. If you're gonna do the turkey, get the turkey breast. Like they sell turkey throughout the year, not just for Thanksgiving and Christmas, you dig? So turkey breast, you know what I'm saying? Either whether it's carved turkey breast, but stay not the lunch meat shit, not that thin slice shit. No, that's not real meat. That is literally shit that's gelled together. Omega 3 fatty acids may stabilize mood swings and have effects similar to the medication lithium, like I talked about earlier. Stay away from sugar. You really got to get into reading your labels and understand how sugar can be disguised. It may not just say sugar. You got to understand, like, starch. Starch breaks down into glucose. Glucose breaks down into sugar. So it's like rice, potatoes, shit like that. Like, yeah, potato chips, french fries, all that shit. Yeah. So sugar is just beyond the crystallized form, you know, is what I'm saying. Avoid alcohol, dairy, caffeine, carbonated drinks, foods with colorings, flavorings, preservatives, and other additives. That's why I say with the turkey, don't do that lunch meat shit. That shit that come in the pack and it's all sliced and you put it in between bread. No, take time, get you a turkey breast and just cook it and meal prep it. That way, if you're only eating it once a week, put it into your, you know what I'm saying, it's develop an eating regimen. You know what I'm saying? We gotta eat better anyway. You gotta take care of our fucking selves. Beware of food allergies that may aggravate mood swings. Use an elimination diet because you're gonna have to go through trial and error to find out which foods are causing the problems and eliminate them from your diet. So pretty much, other than watching what you eat, when you consume it, pay attention to how you carry yourself out throughout that day after that consumption or after you've consumed it. Pay attention to how you react to certain stimuli or your environment or other people. Your food can alter your mood. Take high doses of B complex vitamins, approximately 100 milligrams of major B vitamin 3 times a day. Amounts of individual vitamins in a complex will vary. The B complex is very important for all mood disorders. Straight up. Use injections under a doctor's supervision. So you ain't like a lot of people go and get like B12 shots for like weight loss and stuff. You know what I'm saying? They end up like with B12 and amphetamine and all that stuff, water pill and all that. But no, like B12 is yeah. Well, not B12, but a B complex or yeah, B vitamin shot. Or you can go sublingual for best absorption, which sublinguals mean under the tongue, you know what I'm saying? Some kind of liquid form. Something that is going to bypass your digestion system, because your digestion system, even when you take any kind of medication or pills or anything, when you take that orally and it hits your digestion system, your digestion system is going to eat a lot of that. It's not going to get where it needs to go. So when you do it sublingual or like, example of sublingual, you ever seen people take BC and Goody powders and like no drink, they just let it sit there and hold it under their tongue, but like as they doing it, that headache or whatever, it backs off. That's the quickest way to get something into your system, is what I'm saying. Persons with bipolar disorder does not absorb the B complex vitamin easily, and often have deficiency of those vitamins. Avoid choline, the amino acid ornithine, which is, I spell it for you, ornithine, and arginine, arginine. Do not take any drugs except for those prescribed by a doctor. But we not. If we can't help it, we're not doing that. That's why I'm giving you things in their natural form. Establish and maintain a regular routine for daily activities, and lack of sleep can trigger relapse. So we have to put ourselves on a schedule in order to function efficiently daily. You know what I'm saying? Because like lack of sleep alters your mood. Too much sleep alters your mood. As much as possible, avoid situations that cause stress, such as a turbulent relationship, a difficult working environment. Like if your job is too stressful, and I understand we hurt for money and shit, fuck that money when it comes to this shit. If you ain't got your mind, you ain't finna make no fucking money. And I'm sorry, like, I ain't sorry I'm doing all the cussing. This is how it's supposed to come to you. Stress is a major contributor to serious problems for people who deal with bipolar disorder. Like I say, or I'm going to label it as us empaths, because we take in so much, we absorb so much whether we want it or not. We feel everything, we feel everyone. Like that's how deep we connected to the shit that we connected to. Considerations. This is after my recommendations, the knowledge that I'm sharing with you. Like I say, injections of B12 and mega doses of B vitamins often bring an improvement. The V vitamins have a lithium-like effect on the brain. So you're getting your natural, your organic lithium without having to be on that prescription of a synthetic version of lithium. Amino acids, especially taurine and tyrosine, Taurine, and tyrosine, Tyrosine, are important in the treatment of this disorder. Also, trace minerals, lithium carbonate and lithium citrate, are known to alter the period of rhythmic cycling of the brain and help to even out the moods in persons with bipolar disorder. A lot of people ask me about vitamins or multivitamins, and I tell them you got to understand what's a vitamin and what's a mineral. Vitamin, or I'm gonna give you a breakdown of the word vitamin real quick. Vitamin, or what is called, or what is known as vital mineral. It's a combination of two words. Those are what people feel are the vital minerals for the function of the body. That's not all the minerals that you're supposed to have. We still walk around minerally depleted. So when people ask me about vitamins and stuff, I tell them no vitamins. Get you a multi-mineral with boron in it. And in the other video, I spoke on boron and how important boron is with, I want to say that was arthritis. Lithium drugs' most important role is to prevent and decrease the occurrence of manic episodes. You know what I'm saying? Us getting pissed off and flipping out. It could be something complex. It could be something simple. And we just snap. So those trace minerals and the salmon, you know what I'm saying, the omega-3s, if you don't eat salmon or whatever, get it in the pill form, or get it in the not pill form, but like the gel cap form. Fish oil is what I'm saying. Or a sublingual. Usually taken by mouth as a capsule, tablet, or liquid form. The side effects of lithium drugs can include diarrhea, drowsiness, edema, frequent urination, kidney dysfunction, nausea, slight hand tremors, stomach cramps, thirst, thyroid enlargement, weight gain, and worsening of skin conditions such as acne and psoriasis. So that's why I'm giving you this shit, and I'm telling you where you can get it from in its natural form versus it being prescribed to you as a synthetic. Toxic levels of lithium in the blood can cause blurred vision, confusion, muscle twitching, weakness, nausea, slurred speech, tremors, and vomiting. Lithium levels can be elevated to dangerous levels by changes in diet, strenuous exercise, surgery, or illness, especially influenza. So you got to take care of yourself before flu season starts, so you ahead of it, versus the flu being ahead of you and you got to catch up to it to knock it out your system. But that also has an effect up here. If you must take lithium drugs, try to keep your weight at a regular level and avoid crash dieting. As lithium levels are elevated by sudden weight loss, if you have a physician, keep your physician informed. Like, that's if you're on a prescription. Keep your physician informed of any of the above mentioned circumstances to avoid an imbalance in your doses. Like I say, it's hard to get the right dosage. It takes a while. It ain't like the first time you go and you come upon the discovery that you're living with mental illness, bipolar disorder, and all that. That first prescription is going to do you justice. It has to be dialed in. You got to be conscious of yourself, how you feel, how you respond, how you react, and all that. Lithium drugs should not be taken by people with severe impaired kidney function. Make sure when you do take the drug, take it with food and drink. At least 10 to 12 glasses of water every day. Like, real talk, you should be drinking water, because shit, your body's 70% of this shit. Think about it. Your brain is surrounded by water. It's like the yolk of an egg and then the fluid that surrounds the fucking yolk. So if you ain't got nothing up here to protect that yolk, you know what I'm saying, or the lack of you hydrating yourself, it's the same way of boiling the egg in a pot and you boil all the fucking water out of it and you crack that egg. That egg don't even be done. You crack it and the shit come leaking out. Those are those manic episodes and shit. Lithium orotate. A form of lithium is a form of lithium that is also available. Food is known to increase the bioavailability of the antipsychotic drug ziprasidone or geodone is another name that is known by. In the study, researchers found that eating at least 500 calories per meal, but not as 1,000, was sufficient to obtain maximum absorption of the drug. Really didn't matter how much fat was included, but this sort of diet makes up 500 to 600 calories per meal, with 30% of the calories from fat that is healthy and should help avoid weight gain, which also happens with antipsychotic medications. In fact, weight gain is the second most common reason why people stop using antipsychotic drugs. In other studies, patients with the drug olanzapine or Zyprexa ate 500 food calories each day and jogged 30 minutes 3 times a week, and were able to lose weight and reported the drug remained effective. So that's something you might can look into if you're taking prescriptions, or you want to back away, or if your current one ain't working, try that. If you're not taking your medication for fear of weight gain, speak to your healthcare professional about seeking a dietitian to help you manage your weight as well. You know what I'm saying? It's the same way your healthcare professional is managing your mental. Get someone to help you manage your body and help you regulate that and get it in line. For those who can't tolerate lithium, your doctor may prescribe a anticonvulsant drug such as Devaloprex or Depakote. Antidepressants such as Paxil or Wellbutrin, which is used a lot in bipolar, may be prescribed for the depressive episodes. To control acute manic episodes and antipsychotic medications, Risperdal and Zyprexa are available. Other drugs include Valium. I'm trying to give you the scientific name, but it's kind of hard for me to pronounce it. So Valium for short, and MAOI antidepressants such as Nardil and Parnate. But these aren't used as often because they are less effective. So I'm giving you, if you're on a prescription, be aware. You know, I'm trying to give you bits and pieces to be aware. So if that particular doesn't work for you, at least you got some kind of a foundation of an understanding of why that particular ain't working. Because, you know what I'm saying, most people will take stuff and don't get into the breakdown. Electroconvulsive therapy, or ECT, is sometimes used as a final choice to treat bipolar disorder. But today, the treatment is much gentler than what it was in the past. Cause like in the past, it's pretty much like damn near cutting an extension cord, plugging that bitch in the wall, and take each side. You know, the extension cord be like stuck like this, right? You know, had a little two, and then it's like, you know, together. It's like taking that extension cord, cutting it off from whatever it powered, and separating those wires and sticking them on both sides of your fucking brain. That's how that shit started, like in the mental hospitals, and like pretty much you was just fucking people up, like. So, but it's still used today, but it's more humane shit. And it may be recommended by some physicians. Psychotherapy and self-help support groups are very helpful in the treatment. So pretty much what I'm saying is a self-help group, or just being around people where you that's a common denominator, and there's no judgment. So it allows you to open up and speak about what you're experiencing here. And then you never know, that next person can relate to you, and y'all can share tidbits of information of how you as individuals are dealing it, because you never know what way works for them may also work for you, or it may help you find something that be like, all right, well that didn't work, but you know what I'm saying, you know, it's an exchange of information is what I'm saying. Bipolar mood disorder may be aggravated by a overgrowth of yeast in the intestinal tract and nutritional deficiencies. Food allergies, such as allergies to wheat products and the consumption of large amounts of caffeine or refined sugar, can make symptoms worse. So you got to watch out for that. You know, yeast, like, or like I'm carb sensitive, so like a lot of shit that contain that yeast got a lot of fucking carbs, or like yeast is using like I like bread. Okay, I like bread, but I had to find a way of making bread work for me. So I make my bread from scratch. So, um, but yeah, watch out for that. You know, and the caffeine and the sugars. Like I had to back away from coffee, or like when I make my teas, I had to switch sugar for honey, and then I switched it to agave. You know what I'm saying? So like that works, and then you can implement that to start your day. Tea. You once you find the right tea for this, start your day and end your day with it. Trust. Something that I do from time to time. I'm not consistent as I would like to be, but I'm a work in progress. But yeah, it works. Or another thing, meditation. Start taking up meditation. Start taking up yoga. You got to learn this. It's there for a reason. Learn it. It just ain't for input. You got to learn it. You got to learn how it works for you. Um, Certain systematic disorders can cause depression, including Alzheimer's disease. So, like, as we age, yeah, we gotta take care of ourselves. Diabetes, uh, hyper and hypothyroidism, multiple sclerosis, and Parkinson's disease. Um, any depression diagnosis should be made only after a thorough physical examination to rule out any underlying illnesses. Um, you also like the same way you yeah, you gotta look into like depression and shit too. Nutrients. I'm gonna give you some nutrients that you can take to help. You know, like I say, taurine, vitamin B complex injections, or liver extract injections, plus extra vitamin B6 injections and B12 or vitamin B complex. Um, zinc, zinc. When I say zinc, I'm gonna tell you, a lot of people complain about water. My water got it. I had to learn about water as well, but I'm getting it in one of its most natural forms. And it's crazy. I'm talking about mental illness, but this is my favorite water. Like this. You gotta. I'm gonna make another video about water after this. um, but lithium, which is a trace mineral that alters the manic depressive cycles, producing a greater mood, which they say is only available in prescription. I just gave you natural ways of getting that lithium. Um, Essential fatty acids. Um, they are important for improved cerebral circulation and blood pressure stability. Um, a multi-mineral complex with calcium and magnesium. Vitamin C with bioflavonoids, which aid in brain function and to protect the immune and nervous system. The multi-mineral complex with the calcium and the magnesium I just spoke of. It's going to